Although HGH hormone replacement therapy is a perfectly viable and suitable medical treatment for patients that suffer from human growth hormone deficiency, HGH injections have the potential to produce significant medical complications when abused by healthy patients. There are a number of side effects associated with the abuse of growth hormone shots. We will discuss some of the most common symptoms here. Carpal tunnel syndrome is one of the most significant side effects of HGH abuse. Carpal tunnel syndrome is a medical disorder which primarily affects the joints of the hands and wrists, limiting movement and sometimes leading to painful sensations associated with moving the joints. This disorder can also lead to numbness, tingling, or burning. CTS is the result of any medical issue which limits the ability of the median nerve to pass through the carpal tunnel of the wrist and send and receive messages to and from the wrist and the hand. Human growth hormone abuse has the capability to cause carpal tunnel syndrome because of the manner by which the abuse of HGH affects the bone structures, which surround the median nerve as it passes through the wrist. Although HGH hormone replacement therapy provides immense benefits regarding bone and cartilage health, the same physiological changes which take place that are beneficial at healthy doses in deficient patients can be damaging over the course of long-term abuse. Rather than simply encouraging the healthy development of cartilage and bone, growth hormone abuse causes cartilage and bone to grow abnormally. The wrists are one of the most affected areas in regard to these physiological changes. Cartilage and bone increase in size in the wrists, adding increased pressure to the median nerve, leading to increased pain and discomfort in the hands and wrists, which can eventually lead to permanent disability without treatment. In the case of human growth hormone abuse, if this disorder is recognized and treated quickly enough, it is possible to reverse the effects of carpal tunnel syndrome by ceasing HGH overdose. On the other hand, if carpal tunnel syndrome has grown so severe that the median nerve is actually physically damaged, there is greatly reduced opportunity for recovery. If you begin to feel numbness in the hands as a result of GH abuse, this could be the beginning of a debilitating medical condition, and it is imperative that you stop taking HGH and begin treatment. Arthritis is a disorder of the skeletal system that leads to pain and inflammation of the joints. Arthritis and carpal tunnel syndrome are similar yet distinct disorders which often occur at the same time. The same medical issues which cause carpal tunnel syndrome also reduce the flexibility and increase the pain associated with a normal and full range of movement. In extreme cases, inflammation and swelling associated with arthritis can also cause the bones of the hands and feet to be painfully forced out of position in potentially disfiguring ways. Human growth hormone abuse has the potential to cause arthritis for the same reason that long-term HGH overdose leads to carpal tunnel syndrome. The abuse of human growth hormone causes the bones and cartilage to grow abnormally, increasing the appearance of malformations at particular joints throughout the body, which can cause pain and hinder natural range of motion. Minor arthritis in many cases can be reversible, but the more severe the arthritis, the fewer treatment options available. If you are abusing HGH and experience symptoms of arthritis, stop taking the injections immediately and visit a doctor. Edema is a medical disorder which results in the accumulation of fluids in cavities located throughout the body, especially near to the extremities. The hands, feet, and lower legs are areas which are particularly prone to edema, although it can affect other parts of the body, including individual organs. Human growth hormone abuse encourages the development of edema because HGH overdose causes the body to produce too much interstitial fluid, increasing the buildup of liquid throughout the body. This is another case of too much of a good thing in regard to human growth hormone. Restoring healthy human growth hormone levels increases extracellular and intracellular fluid levels, increasing the fullness and optimal function of the skin and other organs, but too much HGH leads to too much fluid. Edema has been shown to more or less completely dissipate when human growth hormone abuse is suspended, making it one of the least dangerous long-term symptoms, although the disorder can lead to a number of short-term complications. Water retention is a symptom of human growth hormone abuse, which is related to edema, but the two medical issues are unique to one another, even though they share a number of similarities. Water retention is just as it sounds. The body tends to draw in extra water as a result of the abuse of human growth hormone. Edema is a form of water retention, but water retention also occurs in the muscles and joints as well. Water retention is one reason why muscles grow in size as a result of the use of human growth hormone abuse, which most patients find appealing, but going overboard with HGH injections causes the body to store too much water, far more than it actually needs. Water retention persists as a result of long-term growth hormone abuse until an individual makes the decision to suspend their abuse. After this point, water retention subsides and the body returns to normal in regard to this symptom. Some individuals that choose to abuse human growth hormone take diuretics or utilize other methods such as avoiding salt in order to alleviate or eliminate the symptoms of water retention while still abusing HGH. Individuals that choose to abuse human growth hormone often end up dealing with joint pain as a result of their decision. HGH abuse can lead to joint pain for a number of reasons, some of which are interconnected. One of the primary causes of joint pain is the result of carpal tunnel syndrome. Nerve pressure and nerve damage can lead to pain, numbness, and burning in the wrists and hands. Joint pain can also arise from edema and water retention because excess fluid levels around the joints can apply unnatural pressure upon them and prevent them from working as smoothly and properly as they should. Arthritis, acromegaly, and gigantism can also greatly contribute to joint pain because any inflammation or malformation of the bones or around the joints can greatly increase the risk of experiencing pain in the hands and feet, along with other joints such as the elbows and knees. Joint pain caused by long-term growth hormone overdose is reversible in the majority of cases, mostly dependent upon the severity of the individual case. If you begin to experience pain as a result of the use of the abuse of HGH, we urge you to suspend your growth hormone injections and see a physician before long-term damage results. Gigantism is a serious symptom of HGH injection abuse, which generally begins to take place after an extended period of overdose in younger patients that have not yet completed their growth spurt. Gigantism is a disorder which affects the skeletal system, which causes the bones to grow abnormally as a result of growth hormone overdose or other serious medical issues. Gigantism, when left untreated, causes young patients to grow abnormally large in size. This size is often disproportional to normal human beings, and the increase in the size of the muscles and bones puts an increased strain upon the vital organs of the body. Human growth hormone is illegal for use in patients under the age of 30, except in the case of young patients going through puberty that suffer from a severe HGH deficiency, which prevents them from growing to their normal final adult height. Gigantism is an irreversible disorder because of the way that it directly impacts the cycle of puberty. For this reason, it is of the utmost importance to realize that patients under the age of 20 should not consider using human growth hormone for any purpose whatsoever, unless they have been specifically encouraged to by a health professional, in the case of a serious deficiency of HGH. Although gigantism is irreversible, in the case of growth hormone abuse, the disorder stops progressing as soon as GH abuse has been suspended. Stay tuned for part 2 of this video series discussing HGH abuse.